I'll give you the introduction. So mine's a story really of that combines research misconduct and the influence of pharmaceuticals on medical research and conflicts of interest and institutional accountability and NIH funds, which I won't get into, but I think that the previous talk has illustrated that we have a great need here in terms of accountability. It's been 30 years. I identified a potential risk in a clinical drug trial involving children at the Hospital for Sick Children, the largest pediatric hospital in the world. And what was the result of that was an administrative, legal, regulatory, scientific, professional, and personal nightmare. This slide is just to say that I wasn't that vulnerable or young when I came into this problem. I was already been at the Hospital for Sick Children for nearly 9 years. I was head of the largest clinical program at the hospital in HEMONC. I was salary supported by a research award, directing clinical research as a PI, both in Canada, the US, and Asia. And I had just been promoted to a full professorship at the University of Toronto. So I shouldn't have been that vulnerable. And when I identified this problem, it was in an investigator clinical trial that I had begun myself on federal money, the Medical Research Council Canada, analogous to the NIH, which was about as much help as the NIH has been in the past 20 years. And the Research Ethics Board directed me, when I raised these concerns, to change the information and consent forms and make those available to the patients in the trial. And I might add the parents of the patients in the trial, so that they would know there was a different risk-benefit ratio. So the drug company was supplementing this drug trial, was mainly federally funded. And they sent me a letter that says, you may not publish or divulge information to anyone without the previous consent of us. If you do this, we will be subject to all legal remedies. Do not provide any information to the patients. They just need to be told that we've decided to close the study. They shut the study and they cleared all the research drug from the pharmacy shelves. And they sent this in a memo. Thank goodness they sent it in a memo, because it was replayed on 60 Minutes 4 years later, in which the CEO denied saying that. And then Leslie Stahl said, oh, but no, I think he kind of did say it, and he played it back. This is actually a very interesting, even though I'm plugging my own story, 60 Minutes, because it has an unbelievable conclusion at the end of this. So I would recommend, it's on my website in the patient's interest if you want to watch it. This is this pharma CEO. I'm only showing this because about 7 years ago, he died a violent and mysterious death that is still not solved. But before those years, if I stood up and said this room was green, I would have been sued with a SLAPP lawsuit. However, you can't, at least in Canadian law, libel anybody past the grave. So this is the man I was facing for the last 20 years. And you should just take sometimes out of that headline, because he used all his donations to wield political influence. Now, that's not the main beef here. Pharma isn't the main beef. It's the academic institutions, which have been referred to several times during these two talks already. And naturally, I appealed to the chairman of pediatrics, the chairman of medicine, the dean of medicine, the provost, the director of the research at the Hospital for Sick Children, the chair of the Research Ethics Board, and the Center for Bioethics. And also made a lot of unofficial approaches to people who whistleblowers will recommend how we do this, because we know who's influential. Canada is a small country. There are probably 10 very prominent scientists, most of whom are pretty helpful, but the people on the top of this slide were not helpful at all. The month following the CEO terminating the trials and threatening me, the dean of medicine says, well, he's kind of paying for the studies. Do you think this will just blow over? Chairman of pediatrics said, this is a scientific controversy. Then he and the head of research advised not telling Health Canada, our federal regulator, which the REB, the Research Ethics Board, had informed me that I must do. I continued to get legal threats almost weekly, and they were all copied to the administrations. And then the real fun begins, because the administrations began to do something we never used in those years, 25 years ago. They began to bully. We didn't use the term bullying. We didn't use the term gaslighting. We did know the term harassment. And they began to publicly recycle all the allegations that the pharma CEO made against me. And those were some doozies, as I'll get to in a minute. They marginalized and harassed my students. They did the big thing. They always accused you of financial dishonesty, but it was really hard to make that stick, because how do I put this? There was no financial dishonesty. They evicted and bullied my research staff. They delayed all my approvals for other research projects. They removed my research and they closed my lab, and then they actually encouraged a patient to sue. I wish I could tell you that story, because it was really really good and really, really unsuccessful. Then they took the clinical staff away from my program. It's the program of sickle cell disease and thalassemia at the Hospital for Sick Children. And they eroded those resources systematically. And they began to secretly interview my nurses and junior doctors. And then they devised something called citizenship, which was linked to salary. And if you weren't a good citizen, you got a low score and then your salary decreased. So again, the real tenets of this is to hit them where finances hurt. Began a whisper campaign alleging medical errors. They sent private emails to the right-wing press, more about the press later. They documented all kinds of allegations and sent them to the hospital, the Ontario Hospital Association by mistake. And that was a cause of a lot of problems. And then they just kept firing me. They fired me once, then they fired me twice. And I used to talk about this thing, and I think it was my third firing, or maybe that was just before my second firing. And this is why I show you this. This is an article by Suzanne Tober and Morteza himself, because they really, I don't know how they got any work done in those days, because they really followed, let's just bully her. What are we going to do? Let's wake up and do it again. And I'm going to tell you, I wasn't alone. So they weren't just doing it to me, they were doing it to 5 of us. But when I tweeted this article, I got more, not only did I get more engagements than I have ever gotten in a tweet to date, but I got more immediate engagements. I think within a couple of hours, I probably had 1,000 likes or retweets. It was still tweet in those days on this article. And I know that people know. I don't care what official funding agencies are saying and how 1 in 5 isn't really supported and will rely on the institutions. And I'm thinking, if that had happened in my case, that would have been one of the investigations that was discarded. So let me go on. So the ultimate weapon in a doctor is to refer them to the college or their licensing body to remove their medical license, because that's a really big disgrace and really public. And Sick Kids Administration referred me by press conference to that. They announced it at a press conference, so just so the public wouldn't miss that. And they referred me to the University of Toronto for alleged research misconduct. Just fast forward, both of these failed. The CPS, the College of Physicians and Surgeons, basically wrote back a year and a half later saying, what are you people smoking? This is commendable conduct, not indictable conduct. So they didn't appeal that. And the research for the referral for research misconduct was tossed out. And they fired me. This was, of course, reported in the student newspapers more accurately than anywhere else in the press, as it always is. So why? Well, this is actually an understatement by the Varsity, our student newspaper. Sherman was pressing he was pressing a $25 million donation on the University of Toronto, which would be allocated to all the administrative hospitals, including sick children's, but it was going to be matched by federal funding. So this was going to be the largest donation in the university's history. And it was being donated by the man I showed you, Barry Sherman, who told them that, basically, I think we need to get rid of some problems before I give you this money, which never materialized anyway. I'm going to put it this way because I like to quote this from my colleague. Some are led to speculate that the university's failure to support my academic freedom might not have been unconnected to its eagerness to secure financial support. The reason this is so artfully phrased in an article 20 years ago is because every time anybody said anything, we would be sued. Was Arthur Schaefer sued for writing this in the Journal of Medical Ethics? No, but he was sued by both deans of medical school by writing about this in the popular press. So you can see how he phrased it. Some were led to speculate, might not have been unconnected. It was really very a legalistic time. These are some of them. This is by no means complete. And you will see that not all of this, I wasn't a victim in this. Every time the National Post, which I'll get to in a minute, wrote a completely libelous article on me, I sent them a notice of libel and I followed through. Every time the university did something, my own lawyers, I have to say admirably, called me a legal lunatic because I think there's no other way. There is no other way. You can't sit around and wring your hands and say, gee, I wish these people were nicer, because they're not nicer. And so you can see, I won't take you through it all, but Barry Sherman and I were tied up in litigation for 18.5 years. That eventually settled. Now, another thing about lawsuits is that I don't know how we had any money in these days. We still don't, but they always say they're going to take you to court, and you spend 7 summers, in Barry Sherman's case, in legal discovery, and then they settle. They always settle because they don't want to go up against what might be a jury trial, and have listened to the horrific story that I haven't even finished telling you so far. Now, I wish I had a dime, even a Canadian dime, for every time that I'm asked, what about the ethicists? Weren't there hospital ethicists? This was the subject of a lot of debate. Well, it actually was a subject of complete silence because the ethicists in the Journal of Medical Ethics covered about 20 years ago, Françoise Baylis wrote an article called The Olivieri Debacle, Where Were the Heroes of Bioethics? It's just a spoiler alert, there are no heroes except for Arthur Schaefer, the person I just showed you who got sued at least once. They were silent, absolutely and inviolably silent through the entire time. Then we published this paper outlining the problems with the drug, both the safety and the effectiveness of the drug, and things only got worse. So I'm going to tell you why I stand before you today and I'm not living above a Radio Shack, living on poverty. These were my 4 colleagues, none of whom I really knew very well before this all started. And there's lots and lots of funny stories about how they all got involved. But they were all, at that point, full professors at the Hospital for Sick Children, University of Toronto. 3 of them were physicians. 1 of them is a cell biologist. And when I say they were supportive, it wasn't just like, don't worry, Nancy, I'll write you a letter and I'll see you next week. We spent literally 5 or 6 hours a day combating the bullying and the harassment by the hospital, which I've outlined to you very quickly, but went on for years. And asking, had you called the Globe and Mail? No, I'm not calling those people. You call them. Okay, well, have you written a letter to the dean? I'll do the letter. It was a full-time job, and all of these people were very prominent, respected scientists in their own right, and I also don't know how they got any work done in those years. And there were 2 incredible organizations, the University Faculty Association, led by a man who had actually headed the Canadian Association of University Teachers and the Canadian Association of University Teachers itself, and both had exemplary leadership. I don't know what would happen in the days to come, but in those 15 years, these people, we used to joke, we should have rented their offices because we were there almost every day, at least every week. And they eventually produced a report that was a horror story in the involvement of corporations in university research called the Oliv Report of nearly 25 years ago, which just outlines what I've told you. And I usually quote this and not usually quite so revealing. The hospital and the university did not provide effective support. After the controversy became public, the university claimed it had provided support, but this was not true. And that's when I hear people saying, well, we went to the university to corroborate this person's story. I think, I'm sure you did, because that is not where you corroborate these stories. And mine would have been confined to history. So it raised issues of research ethics and academic freedom so important to the public interest that it attracted international attention. And the most prophetic statement that the Olivieri Report authors could have made was, these will be repetitions. So mine wasn't the first, but it was almost one of the very first big research misconduct, bullying, harassment, academic freedom cases, certainly one of the largest in Canada to come to attention. And in those days, of course, we didn't have social media. We didn't spend hours on Twitter telling our stories, and we had to rely on the press. And the press in general, at the beginning, was quite helpful. I mean, I remember my first interview with Time Magazine's and counterpart in Canada is a magazine called Maclean's. And the Maclean's reporter asked to speak to me in the fall of '98, just after my paper was published, and I was getting fired, I think, for the 2nd time. And she sat down in a restaurant and she said, I just had an interview with this senior scientist, sick kids. And I prepared myself for what I usually heard, which was, he's a very fine man. He says a lot of bad things about you, which I'm kind of inclined to believe. And instead she said, he's a real asshole, isn't he? And I said, well, how come you don't think I'm the asshole? She said, oh, you'd have to be brain dead not to understand who's telling the truth in this case. So I thought talking to the press was going to be easy because that was my opener. Somebody who was truthful, someone who did a large story on it, which was for the most part completely revealing and really ticked the academic institutions off. Canadian Medical Association Journal is the longest chapter in my book about how they tried to make sure that we were pilloried and looked like fools. And the CBC, which is like Canada's national broadcaster, did a very large story in 2000, which was the subject of another libel action by me. And you get tired because you can't really keep issuing libel actions every second month, but it pretty well became routine here because the press were so malign, except that there was, and they had a lot of money, right? This cost $50,000 above the crease on the third page of the Globe and Mail. And this is an advertisement by the Hospital for Sick Children's Administration at the time, telling everybody that, well, we're not going to say these people are crazy, but Sick Kids is in very good hands. And they have quotes from grateful patients. There were many grateful patients, but this was the kind of blowback against our criticism of the hospital and the university. And it was very effective in the public view. I just tweeted this the other day. This is absolutely true. And so there was a lot of public relations going on behalf of the hospital and the university by the Canadian press. It was just basically a nightmare. And then something happened. One of the senior scientists, one of the protagonists, one of the people who would have been ruled as completely okay by the NIH was found to have been sending anonymous hate mail to my colleagues, disparaging them. Some of it was racist, and it exploded because my colleague Brenda Galley, against my advice, thank God, she didn't take my advice, decided that she could find the suspect's DNA on an envelope he had licked. And then she sent the DNA on the envelope he had licked and the envelope of the hate mail that had been sent to her to a lab in California, and it identified the suspect by DNA. And it was with senior scientists, the head of the research institute, the associate director of the research institute, the head of the research ethics board, the most prominent scientist at the University of Toronto Hospital for Sick Children, Department of Pharmacology, somebody who was their brightest son and was still defended for years after that. And that made the pages of Nature Medicine because they didn't fire him. They didn't even really sanction him. They just said, maybe you shouldn't send anonymous racist hate mail over 8 months and engender a public investigation that cost millions in which you lied. That was probably not something you should have done. And then a second researcher sent anonymous hate. It was becoming a pretty much of a nightmare. And so my story was covered by John Le Carre in The Constant Gardener. I'm the bitch in chapter 18, in case anybody wants to look at that. I'm not the real heroine of the story, but he said, I came to realize that by comparison with reality, my story is as tame as a holiday postcard. And when I met with him, did this really happen? And I kept going on and on and on, like I've gone on and on to you. And I said, this isn't really what you want to hear, is it? And he said, this is exactly what I wanted to understand. Because I don't think anybody who goes through this, doesn't go through this, understands. You can look at a case and say, well, I guess we corroborate this with the university or the hospital or the administration. But this is, I appreciated the question about trauma, because when you don't know about trauma in these cases, you don't know about really what's happening. Now, where was I? Oh, the regulators, a story in itself. Okay. The FDA, the European regulator, the EMEA, and Health Canada, I sued the European EMEA because when I was in Australia, I was handed a brown paper envelope by some enterprising, publicly minded individual who then ran off. And I realized it was an application for licensing of the drug in the European Union. And it had, this was in the middle of publishing my paper on the dangers of the drug and the ineffectiveness of the drug. And I realized, where did they get these data? So in launching this litigation, I will say only that I discovered, because of an honest Danish judge who was at the head of the ECJ in 2000, he sent me the pleadings by Barry Sherman, who had alleged 3,160 protocol violations in the conduct of my trials. And this is another example of bullying. You accuse the person of scientific incompetence. But if it hadn't been for that Danish judge, I wouldn't have known about being accused of all this. And based upon my alleged incompetence, Barry Sherman urged the European Union to set aside our findings and just license the drug. Thank you very much. But the Danish judge asked him to provide that, and they had to. It's a law, it's court after all. He sent me those, and I financed a large audit of every single detail, every single clinical research form in my trial by a guy named Graham Dukes, who many of you might not have heard of, but he is a lawyer, a doctor, and a former member of the EMEA. So he had all the stories, and he knew what was going on, and he did the audit, and he released his audit 6 months later. And it showed that none of the allegations had any support at all, and there wasn't even a single mistake in the primary endpoints of the trial. So that was a bit of a failure. I write about it in the BMJ a couple of years ago, in which the Alzheimer's drugs were licensed against the recommendation of the entire advisory panel and the resignation of 3 of them subsequently when the FDA licensed it. So I'm not saying there's any real success in taking on the FDA, but taking on a regulatory agency. But 10 years later, Barry Sherman tried the same thing at the FDA, and the FDA came up, thank God, to inspect my trials. I think it was probably the happiest week of my life. An FDA inspection isn't usually a very happy event, but I knew the FDA would see the data and recognize the discrepancy between Sherman's claims and mine, and they did. It's all outlined here, too long a story for me to tell today. So I don't remember who said this, but I wrote a thesis in 2002 in London on the aspects of whistleblowing in medical research, and I can't find in my thesis the citation for this, so I'm sorry whoever said it, but if you have God, the facts, the law, and the press on your side, you have a 50-50 chance of defeating the bureaucracy, and that's about it. So you think this might have ended, but it didn't, because it's gone on for a coda of 18 years, in which, as revealed around 2009, I'm walking down the hall to the Starbucks at the UHN. I relocated to the adult hospital, and one of my patients came up to me and said, am I supposed to be on this drug? And I said, well, it's not licensed. He said, you know, but they're putting me on it. They're putting a lot of us on it. I said, well, no, that can't be possible. But because I didn't have an office anymore, I used to work outside the Starbucks in these couches, and it's a damn good thing I did, because people who I'd been my patients for years would always come and sit down and have coffee, and I would get to know everything that was going on. And this led to an article that's published almost exactly a year ago. There's 2 articles of this. It's taken another 20 years to investigate what's going on at the University Health Network, which is the largest research institute in Canada. We're now not at Sick Kids anymore. We're now at the UHN. And it led to this paper, because I spent years telling the administration that the doctors in the clinic were administering an unlicensed drug. And well, they were, and they had a couple of faux investigations, which made me kind of smile when the NIH guy said, you know, we just rely on we look at the results of the internal investigations. And I'm sure, I bet you do, because all of those are internal, inexpert, confidential, and conflicted. There is no investigation I have ever heard of that is not internal, inexpert, conflicted, and confidential. Anyway, this one was. They ran an investigation on this and said everything was okay. But the problem is, no, the unlicensed drug was given to more than 70 patients in collaboration with Barry Sherman, who is still alive. There were many harms, I've given you the reference, and deaths. And those harms and deaths were not reported to Health Canada, our national regulator, before the drug was licensed. So Health Canada, in a way, can't be blamed for not knowing what they weren't told about these findings. And you'll notice that the UHN had a big donor, between 1 and 5 million in the contemporaneous years, Barry Sherman. So he had just shifted some donations over to the University Health Network. I'll leave that there. So the fundamental issues arising from my story are that in any attempts to disclose harm, and you'll see why I generalize that in a minute, there's the usual bullying, harassment, targeting, reporting research misconduct, which I haven't even gotten into yet, is almost always universally unrewarded. And the university and hospital administrations will always act to enable industry for their own protection. So we actually looked at this a couple of years ago, called the paper David versus Goliaths. And what it looked at was 26 individuals who tried to do the same thing I did, not necessarily against pharma, but they did receive threats, most of them from pharma or from their universities, public disparagement, everything that we would summarize as bullying and harassment. They got it. There's a lot of problems, and most of them were demoted or in a way not officially demoted, but as my lawyers would put it, constructive dismissal. I'm sure some of you have heard that term, in which you are still in your position, but you're actually dismissed. So research misconduct, which I haven't gotten into, and I think I might just leave this part, just quickly go through that. there's this thing on the TTC, the Toronto Transit Commission, and I think it's actually in New York as well. If you see something, say something. And if you say something, you are in big trouble. Like, it just kills me when I go on social media and people say, it's just so important that we all tell the truth. And if we all tell the truth, we're just going to be in a great situation. I think, louder, what universe are you living in? I'm going to skip this, I think, because just to say that all the business about scientific fraud and all the emerging consciousness of it, this is the thing I would read because it's really terrific. It's by Richard Smith, the former editor of the British Medical Journal. And he writes in this blog, he says that, his predecessor at the BMJ, Stephen Locke, thought research misconduct was very, very common, and he was considered eccentric. And now, Richard says, we realize that, I think I'll quote it, it may be time to move from assuming that research has been honestly conducted to assuming it is untrustworthy until there is some evidence to the contrary. And if you want my slides, I have a lot of references on this and the question of whether, in my view, as it should be, should research misconduct be criminalized because it harms patients and causes death in more things than actual professional misconduct probably does, or medical misconduct. I want to say one more thing because my story is so closely aligned to pharma, and that is, does pharma involvement affect the reporting of outcomes in medical research? Does it increase research misconduct? Does it alter? And I think this is maybe this paper has been discussed all kinds of times. It's nearly 20 years old, but it is a phenomenal observation. Every time I read this paper, which I have to say I do often, I think, who are these people's parents? Look at what they agreed to. Ask whether the industry sponsor may decide whether results should not be published. Most of the people here in medical school say, oh, no, that would be bad. But 6 are undecided. Who are these undecided people? Then decide whether the pharma can make revisions to the manuscript. Well, a lot of them think no, but some of them think that's okay. Prohibit sharing of the raw data, very divided. Write up results, but the investigator can review and make suggestions. And essentially, do you think pharma should be able to write up the paper and then you can offer a few suggestions? You're the person who actually did the trial, but never mind that. 50% of them think that's okay. Like, I am just gobsmacked at this. And does the pharma own the data? That is not true, but 80% believe it is. So, and this brings me to the recommendation of Arthur Schaefer again, who says we've really got to separate we've got to separate church and state here and get pharma out of the business of funding medical research. But that's another story. Now, bullying. As defined, I think, by Morteza or others, the abuse of authority that impedes the education and career of the victim through all kinds of the behaviors that I've described over years. And this was a really great review, I thought. It comes from McMaster, where I went to medical school, actually. And they looked at 68 studies. It's a meta-analysis, essentially, of academic bullying in medical settings, something that I guess the NIH has already observed, the common bullying patterns, overwork, psychological distress, which is really quite profound. Consultants are the most common bullies, but as Morteza has observed, there's a lot of bullying up as well. Men are the most common perpetrators. The problem is that a lot of them studies that test the effectiveness of bullying interventions had a high risk of bias, and we're still awaiting trials that tell us basically what we can do about that. And that's where I think the academic parity movement really comes in. I love this quote. This is a great book on whistleblowers, the most depressing book you'll ever read. It's one of my favorites. The key organizational strategy is to transform resistance from an issue of policy and principle into one of private disobedience and psychological disturbances. And academic institutions do this better than anyone else. They do it better than pharma because it's not so obvious. There's all kinds of really well-developed techniques in the sociopaths that run our universities that actually promote this kind of thing. I just put this in for some comic relief. How much is it? It varies. You just keep putting money in until you're broke and hope for the best. So I had a lot of recommendations which apply more to outing research misconduct and whistleblowing than they do bullying. And some of those do apply. I mean, but I think that the basic fundamental truths that I would come down to in the academic parity movement is one of the things that I think has nailed it in terms of what we need to do is that first, I'm showing my colleagues again, because we used to quote this all the time, because out of 700 plus scientists and researchers and doctors at SickKids, these were the 4 that stood up. And we would talk about Dante's Inferno and the hottest places in hell. But what people who are bullied need is support. They don't need the support like, oh, don't worry, I'm on your side. They need the kind of support these people gave me, which is, what's my job today? And Peter is the one on the right. He had a very prominent office in the middle of SickKids, and he would put all the press in a slot outside, and we would hold press conferences. That's what we did in those days. We would invite people to come, and it was such a struggle. And he would talk. He would go down to the cafeteria at the time. Like, I think a lot of the thing about being bullied is that you feel ashamed. You feel ashamed that you're able to be bullied. You feel ashamed that you're a victim. And the last person in the world that was ever a victim was Peter Dury on the right. He would come down and say, you heard about the Olivieri case? And I don't want to talk about it. Oh, I want to talk about it. And he would sit and he would draw people in and he would engage them in conversation. He was effortlessly charming, but he was also very unafraid. And that is what we need. And that's what the academic parity movement really does. It gives us supporters. I'd also say you have to be lucky, like choosing your parents, in terms of your faculty associations and the national associations. The CAUT was unbelievable, and the AAUP was not unbelievable. It was not helpful to a lot of my American colleagues who were contemporaneously going through the same thing. And in fact, the CAUT helped those American colleagues when the AAUP did not. Now, maybe the ownership and the leadership of both organizations has changed, but I can tell you those organizations were fundamental in my case. Also fundamental was the absolute inability, the refusal to be bullied. I mean, I was afraid and I was quite ashamed in many cases that it seemed that everybody was against us and the press was very powerful. But I think you have to believe, I have a 17-year-old daughter, and the thing she hears most from me is, no one can make you feel inferior without your consent, Eleanor Roosevelt. And it's true that you just have to believe that they're crazy and not you. And then that's become really helpful in the last few years. But this all happened in the late 90s when it was really very difficult. I'd also say that no matter what, you've got to use the law, because it's the only language these organizations and institutions understand. Oh, I don't think I'm going to help you. Well, actually, I just sent you a statement of claim. Oh, you know what? I think I can help you. It changes overnight, because if they think they've got any kind of genuine accountability, they will sign up to some accountability. This is also one of my favorite quotes. We should applaud heroes and hope they are among us. To base our hope of remedy in ordinary systems on the existence of extraordinary courage is insufficient. Don Berwick and the BMJ. At the same time, my whole case was erupting. And that's why I think talk about resilience makes people ashamed, because they say, oh, this person was really resilient, or this person really, really stood up. But it's not a matter of resilience. It's not a matter, no, this kind of resilience should not be required by anyone. You're supposed to be doing an academic job. You're supposed to be advancing medicine, in my case. You're supposed to be looking after patients. This is really crazy to make people work through bullying. And that's why the academic parity movement is so important. So why tell our stories? Because I think a lot of the time when I tell these stories, people say, yeah, but things are better now, right? Or like, we can rely on the FDA, right? And I say, don't make me kill you. No, we cannot rely. We cannot rely on our organizations. We cannot rely on our institutions. We have to rely on the academic parity movement and our friends. And so that concludes my talk. Thank you.